Hello all, this is Dr. Shilpi Reddy from KIMS Cuddles, Kondapur. It's a mother and child center. I'm the head of the department of obstetrics. Today we're discussing about hypertension and its implications on pregnancy. What is hypertension and how is it related to pregnancy? Hypertension can be of two types. One is pre-existing high blood pressures, even when the pregnant woman has not planned pregnancy, and preeclampsia, which is a part and parcel of pregnancy, which comes in a mother after pregnancy. So there are two different types of hypertensions. One is pre-existing or essential hypertension and preeclampsia, which is a result of this pregnancy. Let us discuss in detail about these two today. When you have to talk about symptoms and signs of pregnancy, hypertension per se has few symptoms like severe headache, giddiness, syncopal attacks, and restlessness. All these things are towards one end, but definitely whether you have a family history of hypertension or somebody in the family like your mother or the father is hypertensive has to be noted very well. And anybody who is planning pregnancy, preconception visit, mandatorily you have to check your blood pressures. That is how you can even diagnose hypertension from a general population. Who is at risk and who is not at risk can definitely be called for by taking the history of the patient. But then if anybody who is planning pregnancy, one prenatal visit for folic acid supplementation, vitamin D supplementation, checking up of their hemoglobin, blood pressure, weight, height, BMIs, random blood sugars, or any family history, those kind of things have to be done. So anybody with symptoms and signs of severe headache, intractable headache, sleeplessness, restlessness, giddiness, chest pain, neck pains, shoulder pains, all these things, one normal blood pressure check. It can be done at home, it can be done in a clinic setup, it can be done in a nursing home setup, it can be done in a hospital. So once your blood pressure is checked, that itself gives into the clue whether you are normal, low pressure, or hypertensive. So one checkup reading which shows a high value, you definitely have to wait for some more time, give the person rest and ask them to sit idle for 10-15 minutes. With a low anxiety level, you should check a value again. If that is also high, yes, you have to put them on mild medications if they have had sleepless nights and all that, if they are very anxious, or if they have not had sleep for some days, or if they had an episode of any panic attack, you have to give them assurance and recheck their value in about 2 days. So if still the blood pressure values are high, you can label them as hypertensive. So depending on the values, medications come into line. This is all about pre-pregnancy. For somebody who's pregnant, definitely antenatal care on a monthly basis or on a weekly basis, however their schedule is. A BP check mandatory before even consulting the physician, along with your prescription. The prescription itself has blood pressure monitoring. So that is how you can have slight symptomatology regarding the hypertension and how to find out. Risk factors of hypertension are plenty. First and foremost is the family history. If anybody is having hypertension in the immediate family members like your father, mother, or your siblings, anybody can have a high risk factor facing towards hypertension. That is one thing. The second thing can be obesity. High BMIs can also lead to hypertension. Third thing, it can be stress and a personality disorder that can cause hypertension. Excessive amounts of stress can also determine hypertension in view of increasing the cortisol levels, the negative hormones in the body, which can precipitate hypertension. Similarly, hypertension can have various etiologies. It can be renal hypertension, it can be cerebral hypertension, it can be other rarer forms of hypertension. But purely, if you have to talk about hypertension without any other systemic thing, it can be pure rise in blood pressure due to family history, due to stress, due to increased BMIs, that is obesity, it can be even presence of diabetes. All these things can be the reasons for essential hypertension. Now comes the diagnosis, the risk factors for preeclampsia. Preeclampsia is an exclusive phenomenon of the pregnancy wherein the placentation, that means the placental penetration into the uterus, which was not very good, that leads to, and the placental hormones that are secreted by the placenta are the root cause of hypertension. In this, the secondary invasion of placenta, that is the penetration of the placenta into the uterus, does not happen very good. So this is one of the reasons for development of hypertension. So the sole cause of hypertension in preeclampsia is the placenta and the pregnancy. So it itself is the placentation issue that causes preeclampsia. So diagnosis of hypertension is by monitoring of blood pressure, is what I have told. Blood pressure monitoring should be done in a calm state, not immediately after they walk into the OPD. They should at least sit for 10-15 minutes, and to the left arm they check the BP readings, and once, if the reading is high, they can again contralateral arm they check again. If the BP is still high, they even check the supine blood pressure levels while sleeping. So when all these readings are high, then they can be termed as hypertension. Now, what is a level of hypertension value? If somebody's baseline BP, which in their history or in their previous checkups, they know that their baseline BP is 90/60 or 100/80 or 120/90. Any baseline value which is more than 30 in the systolic and diastolic can be hypertension. Or to be on the rougher side, you can have anything that is more than 130/90, you can consider it to be as hypertension or preeclampsia. So both of them, you have to know your baseline values. If there is no baseline value available, any time in pregnancy, you have one thumb rule that the pressure of the pregnant woman should be less than 130/90. So anything that is more than 130/90, by measuring the blood pressures in a calm state, not apprehensive, and 2 to 3 repeated values suggesting more than 130/90 can be termed as hypertension. There are a lot of treatment options for hypertension. We have a wide variety of medications for hypertension management, but the first and foremost thing is to diagnose whether they have normal essential hypertension and put them on safer medications for pregnancy planning and get it very well controlled even before planning pregnancy. That is the role of the physician, who in conjunction with the obstetrician or the treating fertility specialist or the treating doctor has to put the patient in line. And definitely the role of weight loss and management of diet is important. A low sodium diet, good physical exercise is mandatory for the control of hypertension. Along with the medications, you have a lot of lifestyle changes like self-relaxation techniques, meditation, yoga, and all these things. For somebody who's pregnant and has preeclampsia, the first and foremost thing of preeclampsia is it can be risk assessed. So in pregnancy, the first trimester scan itself gives a clue to whether the placenta has not, the blood flow towards the uterus is having a lot of resistance. That can be one clue for having pregnancy related hypertension, that is preeclampsia. You can have the first trimester screening, the NT scan, and the blood markers called double marker or a quadruple marker, which can together give the risk assessment for preeclampsia. So preeclampsia in pregnancy is completely preventable by doing a very good NT scan and the double or the quadruple marker. wherein if there is high risk for development of preeclampsia, you can put them on medications for prevention of preeclampsia, definitely giving you a worthwhile result of late gestational preeclampsias and not early preeclampsias. So prevention role is very, very important in pregnancy related hypertension, that is preeclampsia, wherein we give low dose aspirin and some supplemental medications like L-arginine, leucine, lysine, choline, all these amino acids as supplements to prevent preeclampsia and related IUGR, that is the low birth weight babies. Prevention is very, very important in terms of preeclampsia because that is a preventable option. But when somebody misses on the prevention aspect, or somebody who has not gone through the NT scan and double marker or a quadruple marker, if they develop preeclampsia, then depending on the level of preeclampsia and their pressures, the medications are titrated. Low dose of medication is started and then titrated according to the blood pressures. All this under observation and hospital admission is what we require, because antihypertensives, whenever you give them, it is better to observe the decreasing trend of blood pressures, and how to titrate the medication is really, really important. There are a lot of medications under the teamwork that we give for control of preeclampsia. Drugs definitely give a good control, but a very well controlled sustainability option is depending on the severity of preeclampsia. If it is mild preeclampsia, then the different medications come in. If it is moderate preeclampsia, different medications come in. And if it is severe preeclampsia, which can lead to eclampsias, definitely termination of pregnancy is another option that we look into. So antihypertensive medications are there forefront even before planning pregnancy for essential hypertension, and good screening technique is important for preeclampsia management, and preventive medications give you better results than any antihypertensive medication during pregnancy.